Now, I do get a chance to introduce someone right now for which we absolutely agree with. We advocated for his confirmation. Since he's been confirmed, we've listened strongly to the strong message that he's given. And I'd like you to give and this, by the way, is his coming out party here at APHA. So give a warm APHA welcome to my friend and the head of the Commission Corps of the U.S. Public Health Association, Public Health Service, our Surgeon General, Dr. Murthy.
Thank you, everyone. Thank you so much for that warm welcome, and thank you, Dr. Benjamin, for all of your support, not just today, but for a very long time. I truly appreciate the opportunity to be here. And it's a particular honor to be here with leaders who have dedicated your lives to improving our nation and the world's health. Now, I know that you often don't get a lot of recognition, certainly not the recognition that you deserve. But I know that your work is vital to improving the health and strength of our country and of the world. And I want you to know how much I appreciate what all of you do each and every day. But I want to say also that it's particularly special for me to be here because, as Dr. Benjamin mentioned, this is my first APHA conference as Surgeon General. And people often ask me, what does the Surgeon General do? And it's a good question. I get it a lot. Some people think that my job is to stamp every cigarette box and alcohol container in America with a warning label. And other people think that my job is to provide second opinions on medical conditions, which is why I receive more pictures of rashes than you can imagine. And still others think that my job is about writing Surgeon General's reports. And speaking of Surgeon General's reports, I have some upcoming report titles hot off the presses in Washington, which I thought I might share with you. Let's see, the first one is our upcoming report entitled, Yes, You Can Sit All Day, Why Movement is Overrated. Our second report, the Surgeon General's Call to Action on the Benefits of Partisan Gridlock on Blood Pressure and Mental Health. We'll call these working titles for now. But seriously, today's opening session is just the start of a conversation we'll be having over the next 4 days. A conversation that will continue tomorrow afternoon right in this space with a panel on the National Prevention Strategy featuring Secretary Julian Castro, and I hope you will join us then. But for today, I'd like to talk to you about 3 elements that are central to our work as public health leaders: information, inspiration, and equality. I believe that in these 3 elements lies the key to fulfilling the ultimate mission of public health. Now, sharing information is the part of our jobs that people understand best. And it is more important now than ever before because we live in a world in which half-truths and misinformation can spread around the planet at the speed of a keystroke. When I took my oath of office, I vowed to tell the truth about what we know and about what we don't know, because what we communicate matters. It matters that we share that chronic diseases are responsible for 7 out of 10 deaths in this country, even though we know how to prevent many of them. It matters when we talk to our youth about smoking, recognizing that 9 out of 10 smokers will light up for the first time before their 18th birthday. It matters that we help people understand that 23 million Americans, including 6.5 million children, live in food deserts where they don't have access to healthy, affordable food. Information matters, but how we communicate that information matters just as much. And at a time where people have growing questions about whether e-cigarettes are good or bad, about which diet to follow, about how to protect their kids from the drug crisis, we have to modernize our approach to sharing information to reach as many people as possible. We can no longer rely on traditional public service announcements, running on traditional media, at a time when many people don't get their information from TV or the papers at all. We have to be creative about our messages. We have to find new messengers to take them forward. And we have to use new platforms to take information to where people are. This is how we will modernize how we share information about health. But in 2015, we also know that information is not always enough. Information is necessary but often insufficient to change behavior or to change environments into ones that support health. Now, as professionals who understand that health has to be woven into every strand of public policy and into the environments in which we live, we can't be content solely to educate. We can't allow ourselves to just be another voice in the crowd. And that's why we must consider how to inspire people and communities to translate information into action that will lead to better health. Now, over the last 10 months, I've had the incredible privilege to visit communities all across America, and time again, I've been struck by the stories that I've heard. I've heard from parents who have lost their child to a drug overdose. I've heard from teachers who have watched in dismay as their students eat coffee cake and chocolate milk for breakfast, a breakfast provided, in fact, by their school. And I've heard from doctors and nurses who are at a loss for how to roll back the tide of diabetes, obesity, and heart disease in their communities. Behind these individual stories, though, I have also found that many people feel disempowered. They recognize that so many decisions about what they eat, how they live, and where they can move are determined by their birth, by their zip code, or by forces much bigger and more powerful than them, like the food industry, pharmaceutical companies, or insurers. More and more, they feel their health is less and less in their hands, and this has to change. And it can change, because I have also met people who have found the inspiration to change their lives and their communities for the better. People like the pastor in Birmingham, who made the not-so-simple switch from fried chicken to baked chicken, and in the process inspired his entire congregation to follow suit. People like the community members in Richmond, Virginia, who built the Family Fatherhood Initiative, where they brought public health leaders, faith leaders, and the juvenile justice system together to strengthen families and to improve health. And people like the students I met from Jacksonville, Florida, who responded to my recent call to action on walking by getting other kids to step it up with us. They told me that ending childhood obesity would require kids to talk to other kids, and they are right. What makes the difference between individuals who have lost their power when it comes to creating better health and those who have found theirs? Answering this question is essential to our work. As public health leaders, our goal is to figure out how to move people from a place of pessimism to a place of possibility. Our mission is to connect people with sources of support in their community that will make their journey to better health uplifting, hopeful, and sustainable. Our mission is to help our colleagues in other sectors, in transportation and housing, in education and law enforcement, embrace the role they can play in improving health. If we can inform and inspire the people we serve, we can empower them to not only improve their health, but improve the health of their community as well. This is how we will create a movement around health. Now, no one knows better than you that this work is not easy. But you and I also know why this matters so much. It matters because this is about something much bigger than health. This is about equality. Because health is a means to an end. It is the key that opens up doors of opportunity. It is the foundation on which we stand as we pursue our dreams. All of us deserve the right to pursue our dreams. It's at the heart of our nation's values, a central tenet of our shared humanity. It's why the pursuit of health is the pursuit of justice. It's about giving everyone, regardless of where they live or where they are from, a fair shot at good health and the opportunity to pursue their dreams. We can never fully root out inequality, whether it's in health, in education, in labor, or in justice, until we fundamentally change how we regard each other. There are no set of policy changes, no matter how comprehensive, which can create equality unless we also see each other's lives as valuable, as worthy as our own. In the end, this must be the cornerstone of public health, that every life has value, that every person matters. When we have friends, neighbors, and those marginalized in our communities who have lost faith in that truth, it becomes our job to restore their sense of self-worth, their dignity, and their intrinsic value. As public health leaders, we must be not only technical experts, but moral leaders who ensure that this ethic of equality is part of our policies, our institutions, and our culture. This is how we will change the world together. By modernizing how we share information, by finding ways to inspire and support people in their pursuit of health, and by ensuring that we are creating a world that is grounded in equality, a world where opportunity is available to all. Now, these are lofty goals, but I'll tell you this, they are not beyond our reach. And if you ever need a reminder that this sort of change is possible, consider Jill Stewart. Many of us know the story of Ryan White, the young man from Indiana who acquired HIV through a blood transfusion, a man whose courage and strength in the face of an AIDS diagnosis was an inspiration to so many. But you may not know the story of his friend Jill Stewart. You see, Ryan and his family faced so much prejudice, so much fear after his diagnosis, that they were forced to move out of their hometown in Kokomo, Indiana. And they weren't sure what to expect when Ryan got to Hamilton Heights, his new high school. But what they found was Jill Stewart, the president of the student council. It was Jill, just a teenager herself, who convinced the school to bring in medical experts to educate and inform her classmates before Ryan arrived for the first day of school. And it was Jill who inspired those students to go home and share what they learned with their parents. It was Jill who helped her community understand that Ryan deserved equality and opportunity that was often denied to him in Kokomo. Now, thanks to Jill Stewart, Ryan White showed up for his first day of school and found no angry protesters, no mobs barring his entry to school. Instead, he found an unexpected public health advocate, determined to help him go through school with dignity and respect each and every day. Though Jill's name isn't as well known as Ryan's, I can tell you who has never forgotten her. And that's Ryan's mother, Jeannie, who I met last month, and who still remembers the impact that one person's actions made on her son's all too short life. If there's something that Jill's story teaches us, it's this. We have the power to change the world around us. The question is, do we choose to do so? Our answer must be yes. We must step up and be the leaders the world needs. If we do this, we can create a world we can be proud of, a world that reflects the values we hold most dear, the world our children deserve. Thank you so much.